Coming up on the Sarc Fighter podcast.
I was a band dad, which basically means you move a bunch of stuff 2 or 3 times a day for free.
Right.
And I got to the point where I couldn't do it. I just couldn't do it.
The Sarc Fighter podcast brings you the story of a man who had to learn the hard way that sometimes you have to let sarcoidosis have its way.
Oh, you've got sarcoidosis. Good news. Because we were thinking it was like a lymphoma or, something else or a blood cancer. And come to find out that mine ended up being chronic. And all these years later, it's not good news.
Joe McCorry talks about how sarcoidosis has been a stubborn part of his life for decades.
This is the Sarc Fighter podcast, living with sarcoidosis and other rare diseases. Here's your host, John Carlin.
Hello and welcome to the Sarc Fighter podcast, brought to you in part by a grant from aTyr Pharma. Hi guys, I'm John Carlin. I am the host of the Sarc Fighter podcast and a fellow Sarc Fighter. And coming up is my interview with Joe McCorry, who has been fighting sarcoidosis and all the associated side effects and troubles that come with a case that just won't let go and has not for decades. And it has impacted his life. It's impacted the way he's raised his daughters. And he'll be talking about that in today's interview. But first, I've got to tell you a couple of things about the podcast. The official Sarc Fighter song is called Zombie by Mark Steyer and his band, the White Hot Lizards. Mark is also a Sarc Fighter, and you can hear his story, the story behind the lyrics, way back in episode 12. And I want to let you know, occasionally I will play the entire song for you at the end of an episode. And I did that back at the end of episode 41. So if you want to hear the whole song, Zombie, go back and give that a listen. And those lyrics are so spot on if you have sarcoidosis. And the song is just, it's a very easy listen. It gets stuck in my head, and I find myself singing the lyrics out loud and just having that song repeat over and over in my head, kind of like a pop song that you would listen to on the radio. It's really well done. I call this the Sarc Fighter podcast because I'm fighting Sarc, and so are you, whether you are a patient, a caregiver, a researcher. This is a place where the sarcoidosis community can gather. I know that people tell me all the time they felt like they were all alone. And as much as I can, I want to let you know that there is a reason for hope. But sometimes it's just good to listen to somebody else who's been dealing with the same things you have. And, maybe in Joe's case, it hasn't really gotten any better. But at least you know that he's out there and he's soldiering on and he's finding a way to make it work, even though he's had to slow down. And people just, they want to hear that other people are going through what they're going through. And that's what you're going to hear today. Now, normally I release the podcast every other Monday, and we've been able to stay on schedule with that. I'm always looking for new people to come on the podcast, so please, if you are interested, you can ping me at my email, which is carlinagency@gmail.com, and there's a link to my email in the show notes. And as I am speaking today, as always, my trusty dog, my boxer, Dougal, is curled up on the chair in my office. He has taken over that chair. It is his chair, and he is welcome to it because he makes my life so much better, and I just work better when Dougal's here in the office with me, my little broadcast studio, and he's just hanging out with me. So Dougal and I are doing the podcast together. Now, I want to read you a couple of lines from a blog by Charlton Harris. The name of this particular post is "I Don't Have Anything to Prove While Living with Sarcoidosis." Now, Charlton was a guest here on the Sarc Fighter podcast back in episode 37. The name of his blog is No Tears for Sarcoidosis, and I see his posts all the time by subscribing to a weekly newsletter called Sarcoidosis News, and I'll also put a link to that in the show notes. But so this is just a couple of lines from Charlton's blog. He writes, "And then life got in the way. I had to make adjustments I wasn't expecting. As I often say, when you least expect it, expect it. I had to come to terms with the fact that my life was going to be different. It didn't happen all at once, but at some point I knew that things were going to really change for me. I often look back on years past," he writes, "I had a ball. I enjoyed my life from my teens until my mid-50s. I was having fun until sarcoidosis reminded me it was present. I was still the same person, just living with this condition. Oftentimes, those of us with sarcoidosis let the condition dictate our future. And I can say from firsthand experience," Charlton writes, "that this balancing act is stressful." So again, those are the words of Charlton Harris. But I chose this passage not only because it's meaningful and it's his most recent blog, and it just sort of seemed serendipitous that I would be reading that as I was needing to tell you a little bit more about Joe McCorry, my guest today, because it mirrors what Joe was saying, and it mirrors Joe's experience in life. And Joe was a businessman. He had a family. He has a family with 2 daughters, and they had to grow up with a dad who just couldn't do everything that he wanted to do or everything that they wanted him to do. And so it's been a difficult existence. It is life with sarcoidosis. And Charlton put that very succinctly in just that short passage I read you from his latest blog. And I'll put, again, links to that blog in the show notes. And you might want to go back and listen to Charlton's interview here on episode 37 of the Sarc Fighter podcast. So Joe's story is coming up next right here on the Sarc Fighter podcast.
I feel like a zombie, just feeding and stumbling.
Hi, I hope you're enjoying the Sarc Fighter podcast. You may be wondering, what can I do to help? How can I be a part of the sarcoidosis solution? It's simple. Make a donation to KISS, Kick In to Stop Sarcoidosis. 100% of the money goes to the Foundation for Sarcoidosis Research. Look for a link in the show notes of the Sarc Fighter podcast. Welcome back to the Sarc Fighter podcast. Joining me now is Joe McCorry, all the way from Chicago, and he has got Sarc in many parts of his body. He's going to tell us about that today. Joe, welcome to the podcast.
Thanks for having me.
How are you feeling today?
Today I'm feeling okay. Today's an okay day.
Got it.
And I'll take that anytime. Fatigue is my friend, and today I don't have a lot of it so far.
Awesome. Well, you sent me an email after listening to some of the podcasts and started describing how sarcoidosis has slowly taken over your body. Where did it first present itself, and how long ago?
Approximately the year 2000, I had an inflamed lymph node in my under my arm, under my left arm, and in my right groin, and went to see my primary care physician. And he referred me to a surgeon who removed them in kind of a barbaric way, which was, it was in the office. It was kind of painful. But anyhow, it came as granulomas, and I'm pronouncing that wrong. And I thought I had lymphoma or, something like that. And, everything's okay. It's a granuloma. You have sarcoidosis. My primary care doctor really didn't have any experience with that. Yeah. So I researched a local university hospital and went to see the pulmonologist there. who had sarcoidosis under his name. And up until that time, I started getting like mono-like symptoms, flu, fever, not feeling well. And, he did a chest x-ray and said that I had my x-ray was classic sarcoidosis, my lungs.
Huh.
And that it would usually burn itself out in 12 to 36 months. I think he put me on some steroids, and we did a close follow-up for several years, and it slowly went quiet. And then it came roaring back in 2009, and it was affecting my kidneys.
Kidneys.
Yes.
You might be the first person I've interviewed who's had it in kidneys.
Yes. I had like a sinus type infection at that time, and I was pounding the Advil and just lethargic, felt really bad. And my primary care doctor did some blood labs, and my bun and creatinine came back way out of whack, and sent me for a ultrasound of the kidneys. And then once again, I researched another university hospital. I found a nephrologist. I'd never heard of a nephrologist before, but they follow you for kidneys. And he did a biopsy on my kidneys, which is kind of another barbaric procedure. It's kind of
what do they do? Stick a needle in, or what? How do they do it?
Yeah, it's like a stun gun. It's kind of like a spring-loaded little gun. They don't know or anything. They do an ultrasound. And it took them about 5 shots to get a core. It pulls a core out. And it came back with granulinomas. And then I restarted the prednisone. And the reason I was feeling so bad was my calcium and my creatinine were through the roof. And, the symptom of that is the severe fatigue and malaise. And I heard it described as you feel like you got hit by a truck and the truck is parked on top of you.
Mm.
When people say they have the flu, it feels like I got hit by a truck.
Yeah, yeah.
It's on top of you. And that started the reoccurrence. It went quiet for quite a few years, up until 2009. And then it's a very long story, but I was being treated for the kidney sarc, and I researched another doctor that specialized in sarcoidosis at another university hospital. I met her at an FSR patient expo.
Yep.
In the Chicago area.
Right.
In the late 2000s. Can I mention her name?
Sure.
Dr. Nadira Swice.
Okay.
At that time, she was at the University of Chicago. She's currently at the University of Illinois. She's head of rheumatology.
Okay.
She runs the Bernie Mac Foundation.
Sure.
Which is associated, I think, with FSR somehow.
There is an association there. I'm not exactly sure what it is, but it comes up fairly often. I hear it. Yep.
So I was introduced to FSR and her, and at that time, I was still having issues with the sarcoid. So I followed up with her. She did a lot of blood work that other doctors hadn't done, the CD4, CD9s, the Ts, all kinds of fancy, I call it fancy blood work. And, said your sarcoid's active, and I've been following her since.
Yeah, she was looking for your body's immune defense.
Yes.
Sounds like, yep.
And inflammation markers, I think ESR, okay. Proactive, something.
Okay, all right.
And those are abnormally, for me, it's abnormally normal now to have abnormal blood work, as long as it's not too far out of kilter.
Yeah.
After that, in 2013, I was diagnosed with metastatic melanoma. And the sarcoid played a very pivotal role in that diagnosis because it affects the treatment that they can and cannot give me. My kidney issues and autoimmune issues. So I had this cancer removed from my right ankle, and it had metastasized to my right groin lymph nodes. At that time, the main treatment they had was interferon, which was very nasty and didn't have a very high percentage track record or, helping. So I opted not to have that treatment. And then then it started the close follow-up with the oncologist. So I have the nephrologist, the rheumatologist, the oncologist, and it reoccurred in 2016, like 3 years later, another part of my leg. So we had that taken care of, and they had immunotherapy available at that time. They were talking about chemo. I went to Mayo.
Wow.
Clinic wanted to do chemo, but my rheumatologist was dead set against it. She said, "You'll have kidney failure. Your sarcoid's just going to go nuts. And, I don't recommend that." So we ended up having a combination of two different immunotherapies. Keytruda, which was new at the time, gave me colitis, ulcerative colitis.
Oh.
So back on the steroids, high dose steroids. So during my Keytruda treatments, it was on again, off again, on again, off again because of the colitis, which can kill you and is one of the main side effects of that particular immunotherapy. And then they gave it to me in combination with another immunotherapy, which is an injection called T-VEC. And I had lesions all over my leg in the area that the tumor had reappeared in 2016. And it was surface melanoma, hundreds of these lesions. And this T-VEC was astonishing. I had 5 or 6 injections of this T-VEC, and they all went away. And clear. During that process, I was diagnosed with a squamous cell carcinoma in my left leg lymph node, which was removed, and they gave me radiation for that. So this is the same time I'm finishing up with this melanoma thing that kind of happened.
Yeah, it's really a balancing act. Your doctors are, because were you out in the sun a lot with all these different things? I mean, what's
I had the melanoma in my right ankle, and I'm a fair-skinned Irishman.
Yeah.
Was a kid, I burned like a lobster, like we all. But I was not a sun worshiper by any means. My gut is that being on steroids for such a long time suppressed my immune system and opened me up to potentially getting this cancer. I don't know. We don't know where it came from. But who knows? Non-smokers get lung cancer. So don't know.
Right.
Then fast forward, there's a lot of things I'm missing, but fast forward to 2015-ish.
Yeah.
I went to my rheumatologist, and the resident listened to my heart and says, "You're an AFib."
Oh, great.
I had been to that rheumatologist dozens of times, and they never listened to my heart. And I was tempted to blow off that meeting, that appointment that day, because I had 3 appointments that day. At the end of the day, I'm walking by the office. I'm like, I'm going home. But I went in, and this resident happened to be there. She listened to my heart. "You're an AFib. You're not going home."
Really?
So ER admitted me. Cardiac sarcoid is what I was diagnosed with.
Really?
And it was VTAC, cardiomyopathy, and I'm not pronouncing any of these correctly, and the irregular heartbeat with the atrial fibrillation. So they tried an ablation where they go in through the groin and they burn pieces of your heart. And I woke up during the procedure. They weren't able to complete it. The next day I went back into AFib. So they did a different procedure where they kind of shock you. with the, it's not like a paddle, but it's similar to when they paddle you.
Okay, sure.
They got me back into rhythm.
Okay.
Recommended that I get a defibrillator. And my rheumatologist said, great, but we're going to wait. And she talked to the electrophysiologist. He wanted to go back in and do another ablation. She was dead set against it. She said there's too much risk. And that was sometime in June. And at the end of the year, I had the implant put in.
Okay, the pacemaker with the.
It's not a pacemaker; it's a defibrillator.
It's a defibrillator. Usually, they're well. I had always thought that they were that one was a pacemaker and then the defibrillator activated when it needed to. But this is just a defibrillator.
Just to shock you, yes.
Okay, in case you. So when you go into AFib, it goes boom and puts you back into rhythm.
Correct.
Okay.
That was back in 2015-ish. And fortunately, she told me it went back to normal, the cardiac sarcoid. I get followed for it now annually.
Mm-hmm.
I've never got shocked, thankfully.
Okay.
That started my my journey on infections. So after that period between 2015 and 2019, I was hospitalized countless times for cellulitis, kidney stones, which turned into kidney infections, more cellulitis, which affected my defibrillator because it had a lead going into my heart. I got sepsis. They had to remove the defibrillator because there was vegetation on the lead that went into my heart.
Vegetation.
Infection.
Got it. Okay.
They called it vegetation.
They call it vegetation. Okay. Yes.
So that came out, and I wore an external defibrillator for about 6 months that year. It was basically like a man bra with a big battery on it in case I had a incident. And then they later in that year, they gave me a different defibrillator that doesn't go into the heart. It's called subcutaneous.
Okay. Under the skin.
Yeah, under the skin.
Yep.
It goes to the sternum, and it's a bigger device, more bulky. I can feel it. I can see it. It's under the armpit. It's not up here in the shoulder like a typical one. And that was an ongoing process with these infections. And it was my immune system. I was on the steroids. My immune system was suppressed. Having these immunotherapies just, whacked me. And I wasn't getting the flu. I wasn't getting pneumonia. They were like internal infections. It was cellulitis, infection of the skin. And they were devastating. They came on ripping out of nowhere. And I'd have to, do the 911 or get to the hospital as soon as possible.
I mean, infection where you call 911.
Yeah, twice.
Well, I mean, what are we looking at here? If somebody's listening, they don't understand how.
Not feeling good for a couple of days. In my case, laying down to go to bed, waking up with 104 fever and having my thigh beat red and swollen. And out of my mind with the fever.
Wow.
And either get in a car or go or call. And a couple times we had to call just because it was so scary. And, some of those infections, I needed a PICC line put in. One summer it was 6 weeks of vancomycin every day for an hour and a half.
What? So you are just... This is just terrible, Joe. Joe, what is your? I mean, let's step away from all these different terrible things that are happening.
Okay.
Because I'm having a hard time keeping up. But so you were in sales. You're no longer. So all of this, the sarcoidosis has said to you, you're not going to work anymore, right?
Correct. I can't run my own business and support my family with the level of disease that I have. I just don't.
Right. So what is your walking around day like? I mean, you get up in the morning. Do you have enough energy to, go down and have your coffee, or, what happens?
Yeah. I classify it as how much gas do I have in the tank that day?
Yeah.
I have a finite amount of gas, meaning energy. I'm currently taking a modafinil, which is a stimulant that was prescribed to me by my pulmonary doctor.
Yeah.
And it's similar to Adderall, but it's not as strong and less addicting. And it gives you that boost. So I take it first thing in the morning. And that pushes me through the day pretty good. It's like having 10 cups of coffee.
All right. No side effects from that?
So far, no, I haven't. The side effects would be insomnia, jitters, stuff like that. I haven't had that. Because if I'm not taking that, the fuel tank empties about 1 o'clock and I'm in bed. And I'll 2 hours, 3 hours. Sometimes I'll sleep through the night. And I'll know when I get up in the morning whether it's going to be a good day or a bad day.
Really?
So far is an okay day. But there, out of nowhere, I'll take a shower and I'll be done for the day.
Really?
Literally done for the day, physically. Walking to the mailbox is a chore. Switching the laundry out is a chore. Other days, it's for me a normal day. Exercise, I'm not much of an exercise guy, never have been. But I have to be careful. If I do too much, it'll ruin me for the rest of the day, possibly the next day. And I'm talking short walks, maybe a short ride on the stationary bike, not endurance level exercise.
Sure. But you got to do some exercise because you need to be healthy. So it's good for you, but it wears you out.
Yes, it's a double-edged sword.
Yeah.
Yeah. I no longer, cut my lawn. I no longer snowblow my driveway. I have services do that for me. If it doesn't get done by 10 o'clock in the morning, it's not going to get done.
Really?
Mentally and physically.
Mentally too. So you get worn out. You can't think another thought.
Yeah. Paying a bill, doing something like this, a Zoom call. If it doesn't get done early, it's not going to get done. And fatigue is the main thing now, and it always has been. A lot of sleep. It affects my family. I don't want to say resentments, but Dad's in bed again. How come he's laying down again? Your mom's here. Why don't you come out and visit? And I can sleep for 5 hours and wake up feeling worse than when I lay down.
Wow.
And, depression and anxiety plays into that for sure.
Mm-hmm.
I'm being treated for.
Have you gone to counseling?
Yes. I have a psychologist and a psychiatrist.
Really?
Yes.
How often do you see them?
Every other month, approximately, depending on what's going on, more if necessary. And the depression is a two-edged sword. Am I tired or am I being depressed? Am I depressed because I'm depressed, or am I depressed because I feel like crap? So you have to fight through that, and it's hard. It's hard. And as we all know, people who have this disease, normal people don't understand. On the outside, we look pretty good,
right?
I'm not bald. I don't have bags under my eyes most days. It's not like I'm, getting an active chemotherapy treatment or radiation. I'm not nauseous. I'm not vomiting, but it's just on the inside, it's pretty tough, And it's hard to keep face some days.
Yep.
The world as it is,
Right. Yeah. So you mentioned your family. You have grown kids?
I do. I'm married. I have 2 daughters that are, one graduated college and one is in the process of graduating.
Okay.
One is out of the home and one is down at school.
Okay. All right. And it's hard for people around you to understand, isn't it? Yeah.
It is. It is. Why don't you want to go for ice cream, or how come you don't want to go to the show, or, and this affected me when they were little, because I was originally diagnosed with this sarcoid back in 2000, 2001. They were in, middle school or elementary school.
Elementary school, yeah.
Going to the soccer games and going to the band. I was a band dad, which basically means you move a bunch of stuff 2 or 3 times a day for free. It's like moving out of an apartment.
Right.
And I got to the point where I couldn't do it. I just couldn't do it. It was too much, loading the van and driving to Champaign, Illinois, unloading it, loading it, coming back and unloading it. And it's midnight. It was terrible. Terrible.
Yeah.
And,
that's
on the outside, you look fine.
And people don't understand, and you don't want to look like a slacker.
Yeah.
Right. I mean, you're motivated. You're a community guy. You mentioned that you were in the Rotary Club, which was a Rotarian for a long time. So, you've got this sort of community leadership gene. And the last thing you want is for everybody to think, oh, he just doesn't want to do the hard work and the heavy lifting and support the band. And that's not it at all, but that's what it looks like to people.
Correct. And, people knew or found out or realized what was going on. And most of them were really cool about it. I didn't get much flack from them, but on the inside, you feel like you're letting people down.
Yeah.
More so just besides that, the toll that it takes on you. I would pay for that for days. And sometimes indirectly, I would be hospitalized. I don't know if it had anything to do with those activities, but all of a sudden I'd get a cellulitis or a UTI and boom, I'm in for 5 days. So stress, I've learned that, I've learned meditation. I've learned, trying not to sweat the little stuff, but it's taken a long time, a very long time to, decompress.
So, Joe, you've obviously been through a lot. It's life-changing. You're dealing with the emotional side of this. You're dealing with family, trying to understand, but sometimes getting impatient, and that's frustrating. But you were telling me that you listen to the podcast because it somehow helps you. First of all, how does that help you?
Well, the stories are similar to what I've gone through. The length of diagnosis, it takes a long time to figure out what the heck's going on. You think you've got this, you've got that, you got this, you got that. And then finally you find out it's, in my case, the doctors were acting like, oh, you've got sarcoidosis, good news, because we were thinking it was like a lymphoma or, something else, or a blood cancer. And come to find out that mine ended up being chronic. And all these years later, it's not good news. I'm glad to have the diagnosis, but it's ongoing.
Right. And there's no known cure, as we've discussed.
Yes.
And then you add in a couple of other complicating factors like the cancer that you've had, and that narrows your options. And so now you've got chronic sarcoidosis, and even what we know treats it may not be an option for you.
Yeah, it could. My rheumatologist is always concerned that she's going to wake up my melanoma, by using some of these immune suppressing drugs. I had a hip issue last summer, And immediately she took me off the steroids because she's worried about avascular necrosis. I have no idea what that meant, but I ended up being diagnosed with that, and I had a hip replacement. And a combination of the steroids and radiation from the cancer treatment ruined the circulatory system in my right hip, and my femur bone collapsed. And she knew right away to get me off the steroids, but I had been on them so long, the damage was done.
Right.
So, but
well, I want to go back to that. So your leg collapsed?
Well, I shouldn't. That sounds pretty dramatic. What happens is the ball of the hip loses blood flow and it flattens out.
Okay.
Causes a lot of pain like I've never had before. And they want to put you through the physical therapy and the cortisone injections, and then you end up getting a hip replacement. Best thing I ever did, I was walking on it the same day I had the surgery. It's as if I didn't have that issue, but
Really?
All year last year, from May through November, dealing with that. And it's affected my other hip. I have no symptoms, but the disease is in my other hip. I'm told that the hip bone is the largest bone in your body, and it has the fewest blood vessels. So it's very susceptible to steroid damage called avascular necrosis, lack of blood flow, and the bone dies.
And so you tie that back to the prednisone?
The orthopedic doctor says yes. And also radiation can cause it. And I've had radiation in my pelvis. Heavy alcohol use is another one, and something else can contribute to it. So I had a couple of those factors right off the gate, right off the bat. And he seems to think it was because of the long-term steroid use, even though I was on low doses. Yeah. I was on it a very long time.
What's the highest dose of prednisone you've ever taken?
Well, I had a complication from my immunotherapy that gave me colitis. So I was on really high dose, like 60, 80 milligrams. Oh. My maintenance dose was 4 to 8 of methylprednisone.
Okay.
Long term, I don't think I was ever on more than 10. But the maintenance dose at the end was 2 milligrams every other day. So I was on hardly any. But then the hip gave me the issue, and she took me off it, and now I'm on Plaquenil. She wants to put me on a different drug. I believe it's called Avara. But I recently had some surgeries, and she wants me to heal completely from the surgery before she puts me on the Avara for my inflammation and fatigue, because it does suppress your immune system. And I'm still recovering from some lymphatic surgery I had as a result of the radiation and cancers. I had some lymphedema, and they went clean that up.
Yeah, you were a healthy guy, right? Up until all this stuff happened. Were you? I mean,
yeah.
When you were growing up, did you play sports or?
I did. Yeah. Baseball, golfed. I like to fish. Yeah, just normal activities, for sure. Absolutely.
Yep. And, you mentioned that one of the causes for the hip issue could be heavy drinking, but I haven't heard you say that you were an alcoholic or anything like that. So that wasn't one of the ones that you suffered from.
No.
Yeah.
The surgical oncology, the orthopedic doctor attributed it to the steroids.
Steroids, yeah.
It was no doubt in his mind that it was because of the steroids.
So how do you look at your life now? How do you look at the years remaining that you have on Earth?
I look at it as a bonus. Every day is a bonus. I'm on bonus time right now. I was diagnosed with stage 4 melanoma in 2013 that metastasized and came back. I've been dealing with this sarcoid since 2001-ish. That's affected my kidneys, my heart, my skin. I've had skin sarcoid, by the way, which they biopsy and remove or burn off or whatever. So I look at it as, I try to look at it as a bonus. It's good, but it's different. It's abnormally normal.
There you go. So one of the things that I've heard from people, and I kind of feel some of this myself, is that I need to accelerate some of the items on my bucket list. Do you feel that tendency, and is there anything that you feel like you really want to do while you can do it?
I do. I feel I'm lacking in that area. I see people who, get a very bad diagnosis and they take a trip around the world. I don't have the energy to do that. And I don't think it would be beneficial for me to do that.
Right.
But yeah, there are some things, I'd like to do, but I'm not really pushing much to the head of the line. I'm taking it one day at a time. If I feel good today, that's great. And I'll, take advantage of that and, go to the forest preserve or go to a lake. I don't have those big bucket list things. I'm not, I don't have those because of the energy that needs to be exerted. I don't want to climb, Mount Kilimanjaro. I wouldn't make it.
Right.
It would be a waste of everyone's time and energy. A couple laps around the block, I'm happy with. So I tap down those expectations because otherwise I get frustrated. I look at you, for instance, and, I read your bio. I know you're an avid biker. That astounds me. Someone with sarcoid, can do that. Right now, I'm just not in the position physically to do it. I can pedal around. But I'm not doing the 25-mile tracks or anything like that. And I never did. So I have to let that one go,
Sure. Yeah, that's, I feel like sometimes I feel guilty because I've been able to push through it. And I do think that everything is quieted down for me. And so, but when I get into these phases, and I'm going on pretty close to a year where I've been feeling pretty good. I feel guilty. I feel guilty going on here and saying, I have sarcoidosis and talking about my bike rides. But on the other hand, I feel like I just have to do it. And people tell me it's like, keep doing it, keep telling us about it because it lets us know that maybe, someday we can get back to a normal life. So that's what I'm trying to do is live my normal life. But man, for instance, I've never seen the Grand Canyon, and I'm going to the Grand Canyon next month.
That's something I would like to do.
And you can do that passively. You can
yeah.
You can walk out and look over the edge and say, now I've seen the Grand Canyon.
Absolutely. Yeah, that's on the bucket list for sure.
Yeah. So you've got a daughter in college, no grandchildren yet. Is there a part of you that says, I just got to stay healthy enough to see my grandkids someday?
Yeah, it's not on my radar, but yeah, absolutely. Absolutely. I'd love to, be available for that. My wife went back to work because of my disability and trying to make things easier on her. But also feeling the guilt that she has to go back to work later in life for financial reasons, for insurance and whatnot. So trying to, we just got away this past week, this weekend. We just got back yesterday. We went up to northern Wisconsin for 4 days and just vegged out in the North Woods. And it was awesome. It was refreshing. It was relaxing. And, she got to decompress a little bit, and we just did whatever she wanted to do. I would have fished 24/7 if I, physically could have, but I didn't. I didn't even throw the pole in the water once. We just hung out, which was nice. Very nice.
Yeah.
So, things like that are important right now. But yeah, the grandkids would be great to be physically around for that, and time will tell.
Yep. So what will the rest of today be like? You said like just doing these Zoom calls can tire you out. What will the rest of today be like?
The rest of today, we just got back last night from the trip. It's really hot in Chicago today. It's like 90 with 85% humidity. There won't be much outdoor activity until later in the day. I do have a Zoom at noon. I belong to a cancer support group that meets every Tuesday. So I will sit in on that and participate in that. And I really don't have much of a plan for the rest of the day.
Gotcha.
I'm just going to take it as it comes.
Yeah. Do you think you'll have to take a nap?
Don't know. It's always possible to do that. Right now,
Right.
No, but I could eat lunch and it'll be a different story.
Right.
But I tell you, the modafinil does help me with that on a lot of days. But even with that stimulant, I can still sleep in the afternoon.
Really?
Yeah. And there's no rhyme or reason to it. And there'll be times where I'll sleep for 12 hours. I'll lay down and I won't get up until the next day. And there's really no rhyme or reason. It's not like I did anything physical to warrant that. So
right.
You never know when that's going to hit you.
Right. So what would you say to your fellow Sarc fighters? What advice do you have from somebody who's got it in their heart, got it in their kidneys, has been fighting it for a long time, has been dealing with the side effects of prednisone? Any advice to people?
Yeah, keep searching, keep seeking for medical information. I found you through, I believe, the FSR. I've found my doctors through organizations like that and through the internet. You're not alone. There are a lot of us that have this disease, and on the outside, you would never know it. And there are networking opportunities through some of these organizations where you can talk to people. The Zoom thing is really cool. I don't have a Zoom support group for sarcoid, but it would be really cool. They had that conference back earlier in the year that I participated in and got a lot of information on that. I'm trying to focus on nutrition. Nutrition and exercise are not my strong point, but I'm picking up a lot of information on maybe what I should be eating, what I shouldn't be eating. And there's no answer, because these doctors will tell you, we think sugar is inflammatory, but there's no big study on it. We think, carbohydrates aren't good for you. However, our patients are telling us when they cut out the sugar, cut out the carbs, they feel better. So there's not a lot of medical evidence, but there's patient proof that it helps. So I'm learning about that, sitting in these Zoom and YouTubes. And
I'm going to agree with you 100% on that. I'm also going to refer you back to, and I can't remember the episode number, but with Lindsay Nuremberg, who's a dietitian who I've been working with, and put me on the Elimination Diet.
Yes.
And people have heard me talk about that. I'm not currently on it, but I'm going to resume it once my vast number of summer activities ends. It seems easier for me to do that in the winter when I'm less tempted to be out eating ice cream and sugar. But it was no grains, it was no dairy, it was no sugar. It was extremely clean eating. And Lindsay's husband Ryan also has an episode with me, and I met him first. He's a Sarc fighter. She moved from a good job in higher education and became a nutritionist, dietitian, and really works on this holistic approach. I got to tell you, my thinking was clearer. My steps were lighter. I lost 25 pounds. I wasn't even looking to lose weight. That just happened. So go back and listen to Lindsay and check out her website, Nourished by Lindsay. But it's been, it has really helped me. And, she will tell you emphatically that sugar causes inflammation. Sure. And that carbohydrates cause inflammation. The doctors step away from that. Every doctor I've asked has stepped away from it. But, and then the CBD oil is something I have not messed with, but her husband, Ryan, has been doing CBD and had tremendous success. So again, I'm not recommending it. All I'm doing is passing along the stories of people who have, although the elimination diet was something that really worked for me. And I find that I can tolerate the sugar and that kind of stuff a little bit better now. But it's better when I don't, for sure.
Yeah, I cracked down on the diet about 2 weeks ago, right before we went away. And I was getting benefit from it, feeling much better. The little vacation kind of threw that off, but I agree, it's what you put in. The other thing that I could add to people who are going through this sarcoid, through my sarcoid journey and my other medical issues, don't be afraid to ask the doctor a question. If they're hesitant to give you an answer, don't let them brush you off. They're business people. This is a business. I'm a client. I want to know why my muffler's loud, Mr. Muffler Dealer. And my doctor is the muffler dealer. And we put a lot of these doctors on a pedestal. A lot of them can be very difficult to talk to. But try not to be intimidated. I've released doctors. Doctors have released me, not because of anything mean or indignant. It just wasn't working out. And there's a lot of resources for us on the web. And nothing really happens with your doctor until you hire them. And then you got to stick with them. And you start having complications. You want somebody that you don't have an animosity towards when they're coming into your room and you're unhappy, you feel like crap, and they're cutting you short. So, that's a difficult thing for a lot of people. And, don't be intimidated. They're just business people. And if they're not giving you the answers you want, or your gut tells you no, find another doctor.
I've done that. that.
Yeah. And so often we're intimidated, we're afraid, and they're rushed. And you think you're the only thing they're worried about there, but they're going to see 40 patients that day. You're just a check on the box. So they are not losing sleep over you because you're sitting in the office 45 minutes past your appointment, and then they give you 5 minutes. So find a doctor that has a little more compassion or you feel more comfortable with. And there's like I said, we put them on a pedestal, and it's not best for our overall health. We have to be an advocate for our health, and it's difficult to do when you don't feel good. Bring someone with you. I use my iPhone, and I ask them in advance, I'd like to audio record this appointment if I'm by myself. And you'd be amazed what you hear when you go back home and you play it for your wife, or you play it 2 or 3 times. You'd be amazed what you hear that you thought you didn't hear, or vice versa.
Really? Can you give me an example of that?
Yeah, absolutely. I was with my electrophysiologist, and it was a follow-up after my atrial fibrillation, and I recorded it, and he wanted to redo my ablation. I played it for my rheumatologist who follows me for my sarcoid. She got on the phone and called him and said, under no circumstances are you going to do another ablation on this man. We're going to wait 6 months, And then you're going to put the defibrillator in because the sarcoid will go away in his heart. Other ones, cancer diagnoses, or, biopsy results. I'll be by myself. I'll listen to it. I'll bring it home and I'll explain it to my wife, and then we play it. And I'm not explaining it exactly right. What I heard and what they said are two different things sometimes. So ask for permission. I've had doctors say no, and I deem not to do business with that doctor. He said, get your wife on the phone. I said, she can't get on the phone. She's at work. And I ended up going to another surgeon.
Wow. Yeah.
He wasn't having any of it. I understand, but if you don't want to have any of it, that's fine. I'll find somebody that doesn't mind. Because if I take notes, I'm not good at notes.
And it's really hard to repeat what the doctor said to a significant other. And, once they ask the first or second follow-up question, I find that I don't know the answer.
Yes.
And I try to fill in the gaps, and don't do a very good job with that.
Yeah, you make stuff up. And I'm a little more advanced now in this practice of being a patient, and I ask a lot of questions, and it ticks off some doctors, and they start getting snippy and short, and I'll push them very politely, very, very professionally, and you can hear that demeanor in their voice, and they're like a politician. They're not answering the question, so I like to bring that home too and share that with my significant other who's part of my healthcare.
Yep.
Because like you said, I can't answer all the questions. I can make up answers, what I think he said or she said.
Right.
Yeah.
And then all of a sudden it starts not making any sense.
Yeah, it's a big mess. It is a big mess.
Yeah. I think I want to do a whole podcast on being a professional patient. I think I just decided that. I might ping you back on that and get some people in and just talk about how to be a professional patient, because the more I've learned about sarcoidosis, because now I'm on 2 boards with FSR, plus I'm doing a podcast. And so I've learned, a fair amount about sarcoidosis. I wouldn't say, not at the level of a doctor or whatever, but I can speak the language now, and I know to ask follow-up questions, and most people don't. And I don't think the doctors are ready for that.
No, they're not. They just want to tell you what they're going to do and move on.
Although I will tell you this, my doctors at the Cleveland Clinic are ready for that, and they anticipate that, and they're very giving of their time. And that would be those two, the doctors that I have there would be the exception.
And that's the thing about seeking. I've met those doctors, and I've got them in my hip pocket. If this thing goes sideways on me, I'm going to Cleveland, or I'm going to Iowa, or I'm going to Johns Hopkins. You find these people, and I like to have a plan B. What if my doctor retires? I've
happened to me twice.
Yeah.
One retired and one moved. Yeah.
Yeah. They moved. I've outlived a couple of them. Whatever, things change. So that, we need to continually seek and read up on stuff, because there's things coming down the pipeline that could be of huge benefit to us.
Right. Well, Joe, look, we've been talking for over an hour now. I want to thank you for your time this morning. I really appreciate it.
I appreciate your time, and I hope what I said can benefit somebody.
I think it will. We hear people with lots of complications. I've heard one patient talking about her symptoms, saying sarcoidosis brings friends, meaning that there's always another complication. There's another illness coming down the pike. And you definitely land in that category. And kudos to you just for taking the time to talk with us this morning.
No, anything. And if anybody wants to reach out, call Jeff or call John, and he can get to me, and I can get back to you.
Awesome.
I'd be more than happy to do that.
I feel like a zombie, just feeding and stumbling.
Thanks to Joe for reaching out and sharing his story. Again, if you have a story you'd like to share, here in this sarcoidosis space on the Sarc Fighter podcast, contact me via email, carlinagency@gmail.com. And again, there's a link in the show notes. If you're new to the disease and you're just trying to figure out what you have, what's maybe going on with your body, you've just been diagnosed with sarcoidosis, and like all of us, you're trying to figure out what that means. Is it good news? Is it bad news? Whatever. Go back and listen to my interview with Dr. Simon Hart in episode 2, because that's Sarcoidosis 101. We go over everything sarcoidosis there and sort of break it all down for you. If you want to know more about me and my backstory, that's episode 1. My most recent interview is with the delightful Juliet Coffer of the UK, who's raising money for Sarc UK simply by walking around her house. And for her, that's quite an accomplishment, because 100 meters in a day is a big deal for her. But she kept on walking and kept on raising money for Sarc UK. And so she's just a wonderful interview, and she's got a tremendous attitude, even though she's dealing with a terrible case of sarcoidosis. So, and don't forget to go back and listen to my bonus episode on Sarc and COVID-19, and another bonus episode on dealing with prednisone. Both of these are rare opportunities, as all the leaders in those two fields came together at the right place at the right time, and we were all in the room together. I conducted those interviews, and those bonus interviews are back there on the archives of the Sarc Fighter podcast. You can Google them, or you can look in the show notes. Also, please send me an email if you're interested in coming on the show. Follow the Sarc Fighter on Instagram and on Facebook. I do appreciate your interest here in the podcast. It helps me reach more people and grow the show if you would share a link on your social media. So if you're not in your car driving and you have this link, just post it on your social media and say, hey, I listened to the Sarc Fighter podcast. I thought it was good, and you might want to listen too. And so if you like it, just tell one person. That's all I ask. Just tell one person about the show, and let's help the show and its impact grow. Also, maybe you want to give it a nice review on Apple Podcasts. So thanks again to my guest today, Joe McCorry, for sharing his story. And until next time, keep fighting.
If I had a breath to breathe, I feel like a zombie, just feeding and stumbling. Learn to suffer, you feel pain someday. Learn endurance, your strength will fade away. Dead man walking, trying to keep up the pace. Dead man walking, counting down his days. And I don't know what will come. Look for silver linings, but still I find none. There was potential, slipping gone. It feels torrential, but I'm holding on. I'm holding on. I'm holding on. The fear I fight every single night. Whoa, I'm still upright. Find a way to try and adapt your life. It's not the why, but the how that plagues my mind. A new perspective, appreciate what you've got. We're dead men walking, in an instant it could be gone. And I don't know when will come. Look for silver linings, but still I find none. There was potential, slipping gone. It feels too Wherever there is happiness, fight to be there too. And wherever there are friendly smiles, try hard to smile too. And wherever there is sunshine, don't let fear darken you. And whatever happens, please remember